Good day, I am Trisha Ann Arong, a second-year student nurse in University of Cebu, Manila. And today, I will be doing an oral medication administration on a patient. So let's start. First, let's perform hand hygiene for prevention of microorganism transmission. Second, let's prepare medication adhering to the rights of drug administration. This is to avoid error in giving medication, so by adhering to the other parts of the rights of drug medication administration, the right individual, medication, dose, time, and route. So we should check the patient's chart with its name to ensure the right patient receives the correct medication. So here we have Trisha Ann Arong, and also its physician's name. And next is also compare it with the medication that we have, the dose, time, and route ordered by the physician. So what we have here is the paracetamol, 500 milligrams tablet, and we'll check what the physician ordered to be given to the patient. So it's also the same paracetamol, 500 milligrams, to be taken orally, and 1 tab every 4 hours as needed if temperature is equal to or greater than 38 degrees Celsius. Okay. So now let's prepare our medication tray. Here, our medication tray. And also our medication ticket. If the hospital still practice these. Because some institution doesn't practice giving medication ticket anymore. So as we were about to visit our patient, let's prepare these. So the third step is identify client by reading identification bracelet and by addressing client by name. So this is to ensure the medication prepared is designated to the patient. So you must first greet the patient. Good morning, ma'am. How are you? Great. I am Trisha Ann Arong, your nurse for today, and I'll be giving you your medication. May I ask for your full name and birthday, please? Okay. We must now then verify by looking at the identification bracelet if what the patient is saying are true. So we already checked that. So fourth step, explain procedure and purpose of drug to patients to have patient's cooperation. So, ma'am, today the medicine that I'll be giving you, paracetamol, is for your fever. So fifth, we must now prepare equipments needed for efficiency. So we have here the thermometer, medicine cup, the medication ticket, and also our medication. So step 6, verify any allergies listed on the medication record or electronic medication record. This is for us to avoid allergic reactions. So let's check. According to the medication record of the patient, Ms. Trisha Ong doesn't have any allergies. So next step is step 7, obtain pre-assessment data. So this lessens the chance of medication error. So as paracetamol is for fever, I'm gonna check again the patient's temperature. Excuse me, ma'am. So after the temperature beats or beeps, we read the temperature of the thermometer that was taken from the patient. So it's 38.3 degrees. So patient is experiencing fever. Step 8, we must separate drugs that might be withheld on pre-assessment data. This is to avoid wrong drug administration. Step 9 is assist client in semi-Fowler's or sitting position. This is for patient's comfort and easy swallowing of the medication. Excuse me, Ms. Trisha. Please, lingkod. Balik ko lingkod, ma'am. Thank you. Step 10, we must don gloves if there is possibility of exposure to oral secretions. This is to avoid bacteria contaminating the healthcare workers' hands. So let's just say this is a real scenario and I'm being cautious, so I'll just don the gloves. And next is step 11. Open unit dose packages and place one drug in client's hand or pour in medication cup and give to the client. So provide assistance if needed. So this prevents medication contamination by pouring medication in the lid. We may also ask the client what they prefer. Ms. Trisha Ong, do you prefer drinking your medication from the medicine cup? Okay. So here, when opening the medication, make sure that you don't touch the medication or the tablet. So you must carefully open it. Here. And pour it in the medicine cup. Here's your medicine, Miss Trisha. Okay, so let's just say the patient already took the medicine. And step 12 is to instruct the client to place tablets or capsules into mouth and to follow with enough liquid. So this is for absorption of medicine in the body. So here. Please drink your medicine, Miss. And here's your water. Okay, so let's just say the patient already drank her medicine. Step 13 is to administer liquid medications after pills, instructing client to drink all of the solution and provide assistance if needed. So liquid medication is administered last as it has a faster rate of absorption than solid ones. So I just followed what was shown in the video. So let's just say liquid medication is being ordered by the doctor. So 500 milligrams is still the ordered amount of the physician. So you must make sure that the medicine, the liquid medication, would reach to 10 ml in the medicine cup. So here, you must cover the part with the medicine that has label on it to ensure its protection. And we must make sure not to touch the tip of the medicine from the medicine cup. So eye level, should be eye level. $10 ml. Okay, good. So we have here 10 ml. Excuse me, Miss Trisha. Can you drink your medicine, ma'am? Okay, so the patient already drank her medicine. So step 14, we must remain with the client until all medications are taken. Check mouth if there is any question of whether drug has been swallowed. So this is to make sure all medication was taken by the patient. So excuse me, Ms. Trisha, kindly open your mouth. Say ah. Okay, great. So step 15, you must reposition client and place call light within reach. This is to provide comfort and easy notification of the nurse's station if Ms. Trisha Ann Arong is having a problem or needs assistance. So she just needs to press this. So Ms. Trisha, here's your call light. Just press it when you need assistance or you need help, okay? So step 16, lift side rails to avoid patient from falling. So here we already have some side rails lifted. Step 17, discard or restore equipment properly. So if client refuses drug or drug has not been given for any reasons, do not leave drug at the bedside. So we must not leave here the medicine. So we must remove drug from the room and restore in medication drawer or cabinet only if an opened unit dose package. So if unit dose package has been opened, discard it in sink or flush it in the toilet with witness if necessary. So this is to ensure patient safety and secure or maintains drugs potency. So documentation is also a must so that necessary actions would be taken if ever the patient refuses taking the medicine that was ordered by the physician. So step 18, remove gloves and perform hand hygiene. This is to prevent spread of bacteria. So let's throw this the proper place where we should throw it. Perform hand hygiene. So step 19, document administration and medication administration record. So this is to keep records of given medications to the patient. So now we will record that we already gave the medication to the patient. So since it's still morning, we administrated the medication in the morning, so we will put it here in the A and put our the time given and its signature, our signature. Okay, so we're good. So lastly, step 20, we must assess the client 30 to 60 minutes after administration and document client's response to medication. This is to know if there are any adverse effects after medication intake. So good morning again, Miss Trisha. So how are you feeling? Are you feeling better? Okay, that's good. So that's all for today. Thank you.